Hi everybody, I'm Mike Reinold.
I'm Erson Religioso.
We are here to talk about instrument-assisted soft tissue mobilization, essentially a manual therapy technique, a soft tissue technique, where we use an instrument to help us apply loads to different tissues in various techniques. A really neat adjunct tool that we can use to our manual therapy belt that I think provides a ton of benefits and really just gives us another skill set and another tool in our toolbox that we can use to help people get better. But I wanted to talk to Erson a little bit today, just about a few things about instrument assisted. One, I think this is always interesting, and maybe we'll both share. But for you, how did you start using a tool? How did you start using the instrument assisted? Why'd you do it initially?
Well, it was about maybe 10 years ago or so. I was actually treating the son of the head of the local chiro college in Buffalo, and he was actually pretty impressed. I made sure to actually do a couple thrusts on patients to let him know, like, hey, we can do this too. So I thought he would actually be pretty opposed, and instead he was actually really happy. And he came in with his son's next treatment. He said, hey, you know what? I think you're going to like these. So we unwrapped a set of tools, and he said, try scraping your hand against someone. Now hold the tool and scrape it against someone. So you could definitely feel a difference, and that was my first foray into that. And I thought, wow, this stuff is awesome. So for years I was using a reflex hammer or a spoon or whatever, and then I tried a couple other tools on the market, and then I decided just to make my own. So that's how I got started. I was introduced by a chiropractor.
Wow, yeah, that's pretty neat. For myself, I was actually introduced by a patient. So I guess a different way of approaching it, but somebody that had it done elsewhere, and essentially said, how much better it made them feel. So for me, I mean, I'm not going to discredit anything right off the bat. If a patient tells me they felt great doing it, I'm super excited to kind of look into it. So that's how I started looking into it initially. And for me, I think it was just it was a combination of several things. People tend to like it. At that time in my career, my hands were actually getting sore. I actually have some issues with my hands sometimes. So it was a welcome addition to my toolbox. So that way I can take a little load off my hand. And initially, I mean, I was a little skeptic. Am I going to lose some of my feel? Am I not going to get as many good results by using a tool instead of my hands? But now I think it complements everything else I do.
I agree.
So I feel like I get a ton more out of it. So it's funny. So you were introduced by a chiropractor. I was introduced by a patient. Well, technically both patients.
Right.
It's something that I think we both kept for years. So something we're excited, obviously, to share with you guys a little bit. Tell me a little bit, Erson, how do you integrate it with the rest of your techniques? So, obviously this is just one simple technique. This isn't, I would never have a patient come in and just do a little scrape and send them out on the way. How do you integrate it with the rest of your manual techniques?
Well, one of the advantages is that there's less contraindications to tissue work, whether using your hands or a tool. So I found that, say little old ladies, people are like, oh, seriously, you use this on little old ladies? Yeah, if you have a frozen shoulder, it actually hurts them more to work on their joint mobilizations. So whether it's a little old lady or someone who just couldn't tolerate joint work a lot, when I started doing tissue work as a prep, I noticed that they moved better. So if I was going to prep someone to move, whether it was with joint mobs or just exercise, I found that it worked better to enhance their movement. So if someone needed to have either increase in range of motion or increase in movement quality, I use it as a prep for my other treatments. I use it before spinal manipulation or joint mobilization. I use it before neurodynamics, and I find that all it does really is it helps someone move better. So all our goal as PTs is always usually quality and quantity of movement. So I just use it as a movement prep.
Yeah, and I think the only thing I would add, I mean, I think I use it exactly the same way. The only thing I would add was I would do it before corrective exercise as well. Some of our rehab techniques or our repeated motions, whatever it may be, it's get your soft tissue moving, get your joints moving, and then try to get that to stick a little bit with some of your corrective exercises. So good. And lastly, let's just talk about maybe just, if you're unfamiliar with instrument assisted, what in your practice, what have you found to be some of the major benefits? Like why do you think somebody that may be watching this, should pick up instrument assisted soft tissue as a technique they should use?
Yeah, and Mike said it earlier too. I definitely, in my late 20s, noticed my hands started hurting already. I was doing a ton of tissue work. By then I was already convinced. But I didn't have any tools, and it was harder to hold things that were shaped like a reflex hammer or a spoon. So I looked for something that I could hold easier. So it was hand sparing, absolutely. Because if you're putting a decent amount of force into something, it's easier to apply it through a tool rather than your hand. You're just going to save your hands. As a manual physical therapist, I want to be able to save my hands. So that's the first advantage. But the second advantage I found was for tone reduction. A lot of stuff we're doing with tissue work, we're trying to reduce some tone. So I found that there were certain areas, and the first one is the upper trap. You want to come around here? So a lot of people have this big kind of trigger point in this area. And I found that she could even feel that when I'm palpating skin on skin, some of this is this dysfunctional tone, right? So when I push on this, it kind of pushes back at me. So for that, she can feel that, and is that comfortable?
Right now it is.
Yeah. Okay. So there's a certain point and a certain amount of depth I can achieve with my hand, only because the tone is kind of pushing back at me just a bit. When I do this, I can just get just a bit deeper. That's not entirely visible, but you can try it on yourself. Try it on yourself in another area with tone. Masseter often has high tone. So when you stroke in a proximal to distal direction, you can release that. But if you're doing with an inanimate object, I can penetrate just a bit deeper, because again, that tone is not pushing back at me quite so much. So that was a big advantage to me to use tools is for tone reduction. When you're working in any area with high tone, working with an inanimate object versus your hands, as good as your hands can be, again, when something has high tone, because of that PNF or facilitatory effect, it kind of pushes back at you. So just a way to release tone faster.
Yeah, and I think I would add, just watching you actually just came to my mind, like some of the, I think the benefits that, I say, yes, a little bit is it adds a different feel to your hand. So everybody talks about how, do I feel better with my hands versus the tool? I think I feel different, and I think they're both acceptable. And I almost think of it as, a concept of like three-dimensional soft tissue. So different layers or depths of tissue you access using different techniques. So with the tool, again, just as an example here, we can just be real gentle and superficial and kind of work at the top layer, kind of myofascial layer, or we could get a little bit deeper with the tool, into different tissue techniques. And then again, because it's an adjunct treatment, I'd use my hands then in a different method. So whatever it may be, so I've just different levels of depth of penetration or so to the soft tissue that I can achieve by integrating this with the rest of my techniques. Maybe whatever other techniques you like to do, whatever type of motions you may do, adding that, you get superficial, medium, deep type layers. So,
right. And also, in some ways, it does enhance the feel, which is what a lot of other tool makers promote too. But there's nothing magic about it. There's nothing. When you scrape and you kind of feel that very superficial grit of that first layer of myofascia, you can just feel it a bit better with the tool because the tool doesn't give, because it's solid. Your hands give a little bit, and sometimes, again, the harder you press with your hand, the less sensation you have. But you will just be able to feel that grit or that kind of superficial restrictions a bit better with the tool rather than with your hand. So I would say it enhances your feeling. That's why I use it a bit more than my hands, unless I'm doing some sort of bending or functional release, which you can't quite do with the tool.
Yeah, I agree.